If you have been out working in your yard, possibly hurt your shoulder, pruning some shrubbery, guess what? You're not alone. And guess what else? There is help. So great to welcome Dr. Nick Circolone from Apple Apple Chiropractic, Orthopedics, and Physical Rehab.
And rehab, just rehab.
Basically, it's a one-stop shop for fixing you up. Good to see you, Nick.
It's good to see you being here again.
Okay, so this is a real common thing. People hurt their shoulder.
All the time.
But they don't always know where to go and get help.
Exactly.
It's beyond taking to a leave.
You know, a lot of times what will happen is somebody will be weekend warring. They'll be out there water skiing. They'll be out there playing sports, trimming shrubs, and their shoulder starts to hurt and they don't understand why. Sometimes it's a sprain strain. Sometimes it's a rotator cuff involvement. Well, you know, a lot of times they'll get anti-inflammatories, but they're not fixing the problem. When they come into our office, what we're looking for is to find out what caused the problem, find out what we can do, what structures are involved, and then fix it not only by manipulative therapy, but also with rehab. You know, giving them exercises they can do at home to help strengthen that up. And sometimes what we'll do is we'll preempt it and say, listen, if you're going to be doing these things, if you're going to be exercising, if you're going to be working in the yard, let's get you doing some exercises and some stuff that's going to strengthen that area so you can do this without injury. Simply
by being a chiropractor, you're obviously tuned into the whole fluidity of the body, you know, the circulatory nature of the body, but then you throw in your orthopedic training on top of that, and that gives you an added set of expertise that you bring to the problem.
And, you know, instead of having surgery done on something, and we talked about this the last time I was on, I'm one of those people, I'm not against surgery, but let's do surgery last. Let's have something else that we can do prior to that. And with chiropractic and with the orthopedic fellowship that I have, we're able to get in there, look at the patient, evaluate the patient, give them other options, long and short of surgery. Now, if you need surgery for something, let's go ahead and do it.
Sure. And if you find the problem early enough, then you can kind of get in there, can't you, and even move some things around with manipulation to offset the surgery.
Absolutely. Sometimes we have a problem where it may be a cervical issue. It may be a thoracic issue associated with the shoulder. If something's not working well in the spine, it'll sometimes relay back into the shoulder or other joints of the body. And what we do is we look for that as well. And then once we get those aligned and fixed and rehab that area, that's where the healing process occurs. One of the things that we do in our office that really helps a lot is I'm looking for something that we can do at home. I'm going to give you rehab that you can do at home. It's okay to do it in my office, but if you're not doing it at home, it's not going to help you at all.
Okay, so kind of like the difference between the cold and the flu, how do you know? If you're out there doing something fun this weekend, you wake up on Monday and your shoulder hurts, do you give it a couple of days to see if it just kind of works its way out?
Absolutely. You want to, you know, it's one of those things where if it starts becoming a chronic condition and is lasting, you know, a week or so, then we'll take a look at it. But sometimes you're just going to strain it, it's going to be sore, and usually goes away by itself.
And is spreading a warning sign too if you begin to feel the pain spread to other parts of your
We're talking more of a nerve pain at that point. Sometimes it's more of a trigger point. We talked about trigger points a long time ago too. Sometimes a trigger point will refer to different areas of the shoulder and into the hand, and sometimes up into the neck and give you headaches.
One more great thing about Nick, if you're wondering, is he's also an excellent listener. No one person's story is a short one. You have to hear the whole story of what happened, and Nick will listen. You'll find him at Apple Chiropractic, Orthopedics, and Rehab on Shallowford Road, 855-7376, applerehabgroup.com. Thanks, Nick.
Thanks, Julie.
We're back after this.